This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, May 12th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. The World Health Organization is issuing a strong warning advising nations to ensure that the COVID-19 pandemic is under control before reopening. WHO Director General Tedros Adhanom Ghebreyesus says that countries should also have surveillance systems in place to be able to detect and manage any resurgence of cases and ensure that their health systems can cope with a possible resurgence after reopening. The WHO chief says there are about 7 or 8 of what he called top vaccine candidates among the many currently being developed around the world. Turning to Africa, Senegal has reopened mosques and churches Tuesday and eased other restrictions imposed to contain the coronavirus outbreak following an announcement by President Macky Sall. The move came despite Senegal registering 177 new cases of COVID-19 on Monday. President Sall is also relaxing the state of emergency measures Tuesday. Curfew hours are now 9 p.m. to 5 a.m. instead of 8 p.m. to 6 a.m. Senegal has reported nearly 1,900 coronavirus cases and 19 deaths. Ugandan President Yoweri Museveni says it doesn't make sense to hold a presidential election set for early next year if the COVID-19 pandemic is still ongoing, signaling for the first time a possible postponement. Museveni told Uganda's NBS television that it would be, quote, madness to hold a vote. Worldwide, the number of confirmed coronavirus cases is about 4.2 million. The global death tally is more than 286,000, according to Johns Hopkins University. As many businesses reopen across Nigeria, workers are adjusting to the new reality created by the COVID-19 pandemic, including shorter work hours, pay cuts, and higher unemployment. Nigerian authorities expect the jobless rate this year to hit 1 in 3, while the International Monetary Fund says the economy will shrink by 3.4%. Timothy Obiezu looks at how the unemployed are trying to cope.
Emmanuel Noble searches his phone, hoping for a response from one of the many places he has approached for a job. It's been a daily struggle for him since he was laid off as a bartender at an Abuja nightclub in March following Nigeria's coronavirus lockdown.
You can imagine in a situation where you stay and you don't have any source of income. It's very difficult to bear. We've been at home all through. Nowhere to go. You just sleep, wake up, walk around, nothing to do, no engagement.
Nigerian authorities began easing a nationwide lockdown last week, but maintained restrictions on schools, religious bodies, and businesses like nightclubs, bars, and gardens where crowds usually gather. Millions of Nigerians whose livelihoods depend on these businesses and institutions are having a hard time.
It even got to the extent that I wasn't able to get a recharge card to load in my phone. I can't make contact. So you waking up, it's just like most movies we watch. You see most people hopeless in the movie.
Nigeria has been battling high unemployment for years, but this is something new. Labor officials predict the unemployment rate may hit 33% by the end of this year. The coronavirus pandemic took a bad situation and made it even worse, says the local head of the International Labour Organization.
Over the past few years, we've been seeing an increase in the number of Nigerians who are unemployed. And also because of new and young Nigerians entering the labor market, who are not able to find jobs, this has further exacerbated the situation. So now, coupled with the pandemic, the COVID-19 pandemic, the situation is of very serious concern, and it could get worse depending on how this pandemic evolves.
Businesses across Nigeria are adjusting to coronavirus by operating for shorter hours and cutting workers' salaries in order to survive.
We should not be oblivious to the fact that some of them are still struggling now because the weeks of shutdown really affected their ability to generate working capital, which they then use for their own business operations.
The International Monetary Fund says Nigeria's oil-dependent economy will contract by 3.4% this year because of the fall in global oil prices triggered by the coronavirus lockdowns. That is not good news for Emmanuel Nobu. He plans to keep looking for work, but his job search may go on for months to come if there is no major improvement. Timothy Obiezu for VOA News, Abuja.
COVID-19 lockdowns are saving lives but ruining livelihoods for millions of workers across Africa. Africa 54's Paul Ndiho spoke to Paul Orajiaka, Chief Executive Officer of Auldon Toys, a leading manufacturer of African-themed toys. Orajiaka has made his mark selling and manufacturing toys in perhaps one of the largest and busiest open-air markets in Africa, called Idumota, located on Lagos Island. He explains how COVID-19 has affected his business.
Paul Olajiaka, welcome to Africa 54.
Thank you.
How are things in Lagos? I know you guys have been under lockdown. How has that impacted your business?
It's been a mandatory lockdown for everybody, and literally there's been zero movement within Lagos. So the whole idea is we're all been indoors in the last 5 weeks, and certainly what it means is that there is no trade, there is no transaction, everybody's locked down. So literally, I and the staff have been home for the five weeks now. You
are arguably one of the largest toy manufacturers. Is the entire business chain affected? Do you still have orders somewhere that are waiting to be distributed?
Our business has actually been thriving in terms of not just in Nigeria, but in the rest of Africa. But with this lockdown, all the chain stores across Africa that would normally have embraced our doors, our Unity doors, are all on lockdown. So what it means is that it's zero business for now, and it's been impacting our business. We have a lot of stock, a lot of orders that were pending before this whole lockdown. And at the end of it, so we are unable to meet these demands because everywhere is locked down.
In terms of your employees, are they safe?
What we try to do is tell them that while you stay home, make sure you stay safe. It's not just for them to stay home, but rather if you stay home, make sure you stay safe. Don't entertain guests, don't entertain visitors. This is not the time to embrace your relatives. Everyone should stay safe.
When I visited you in Lagos, you took me around your workplace. The amount of people who depend on those transactions, everyday transactions, the people who work in that market, are all at home, seated, and there's nothing happening as we speak.
Certainly nothing is happening. Even the worst hit are those who actually earn daily income to stay and keep their families afloat. These people, like you see in Idumota, those women selling the food, the drinks, those people carrying people's wares when they buy them, all these people have been daily wage earners, and every one of them are hard hit. And that's why the government is having a lot of challenge in terms of relaxing the lockdown so that people like this would come. There's been a lot of agitation, people staying at home, being hungry, not having anything, no income. So it's been a delicate balance for the government on how to handle this and at the same time keep people peaceful and not agitating as they've been doing the last couple of weeks.
I know for a lot of employers, especially here in America, people are losing jobs left and right because of the lockdown. Since you're an employer, are you able to keep all these employees? Do they expect to receive their salaries when they go back?
We've actually kept our salary at 100% because we have this faith that when we come back, we could actually make up for the lost ground. So there is no point because even while they're home, they still have to feed, they still have to live. So for me, I make sure that they earn their full salary.
I brought up a very good point. A lot of our communities, especially in Africa or in Nigeria where you are, we are very sociable people. And some of the guidelines really are geared towards keeping us apart. Even if, let's say, business was reopened, how can the social distancing guidelines apply in a place where you work?
Paul, you know why I'm laughing? Because we've opened business in the last 3 days. Paul, it's crazy. The market is booming like never before because the windows are tight. 6 hours. Everybody has to be in the market within that 6 hours and get out of the market within then. So you could imagine the rush. And that's why the government is threatening that with this level of irresponsibility, they might be forced to implement another total lockdown.
When I met you in Idomota market, arguably the largest market in sub-Saharan Africa, you told me that you have ambitions too. You want to give back to the community that has given you so much. What did you mean exactly?
What it means is that I'm actually putting myself up for a political office, and next year, 2021, I'll be running for the governorship of Anambra State. This is where I come from. This is a state that is known for its entrepreneurial spirit. So I believe that people like us who have actually built our entrepreneurial journey from nothing to something would actually bring a lot of expertise to governance.
Thank you so much for your time, sir.
Thank you, Paul. Nice speaking with you.
A pleasure.
That was Africa 54's Paul Ndiho speaking to Paul Orajiaka, Chief Executive Officer of Auldon Toys. A main coronavirus vaccine trial, a joint venture between an American and a German company, is underway in the United States. Some participants are American medical students. This trial joins others around the world as pharmaceutical companies compete to discover the breakthrough for COVID-19. VOA's Caroline Presutti takes us through what is being done and how.
Michael Sikorsky is about to make history.
Look in that corner.
He is the 7th medical student to get an injection of a trial vaccine for COVID-19.
1, 2, 3.
I feel a sense of responsibility and obligation as a young, healthy adult who can participate in one of these early trials to do so.
Sikorsky and 360 others are in the first phase of vaccine trials run by Pfizer and its German partner, BioNTech.
And you could do all of this from the outside.
The company is simultaneously testing 4 vaccines using a newer method called mRNA. The vaccine introduces part of the virus's genetic code through RNA. The body treats it like a foreign protein, which generates an immune response. Pfizer's Mikhail Dolstein.
And now the body is ready. It has memory. And once the real virus knocks on the door to infect us, we respond fast and intercept it.
The challenge for Pfizer is to prolong the life of the antibodies in the cells. Many drug companies are racing to become the first to conquer the virus. U.S. firm Moderna, along with the National Institutes of Health, is using mRNA in trials that began last month. Inovio has already started its efforts using a DNA method. BioNTech Pfizer began its trials May 5th, while China's CanSino Biologics is ahead of the others, already onto its phase 2 trials. The University of Oxford in England started trials last month, and Wuhan and Beijing researchers are using a traditional trial method, injecting inactive viruses. The nation's leading infectious disease expert predicts the world will have an effective vaccine by October.
And then the challenge will be to scale it up enough to be able to distribute it meaningfully.
Meanwhile, participants like Sikorsky are monitored for vaccine safety.
So every night at 9 o'clock, I get a little buzz on my cell phone that reminds me, fill out your safety diary. So I take out the thermometer that they gave me and I check my temperature. And then I fill out a series of questions, which include, do you have any aches or pains? Do you have fevers? Is there swelling?
If all goes well, a coronavirus vaccine is expected to be in circulation by the end of the year. An unprecedented rapid development for a vaccine. Caroline Presutti, VOA News.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a discussion with an expert about the impact of COVID-19 on malaria control in Africa. We'll be right back after this break.
Chibwana chimalata, chibwana chimalata, ukakhala pabwino, poyipa pamayitana. Chibwana chimalata, ukakhala pantchito, ulova umakodola. Chibwana chimalata, ukakhala pabanja, umbeta umayitana.
Welcome back to Africa 54. And now for more health reports, here's Africa 54's health correspondent Lino Mudu with the latest news on malaria.
Thank you, Esther. The World Health Organization has warned that malaria death in sub-Saharan Africa could dramatically rise due to border restrictions and disruptions caused by the global pandemic of the COVID-19 coronavirus. I spoke via Skype to Valentina Buch, Global Malaria and Health Partnerships Advisor at UNICEF, and asked her about the impact of COVID-19 on malaria control.
It is unfortunately a very highly likelihood of the lockdowns. We are hearing many reports that because of the lockdowns, families, in particular children, are not going out to seek care for when they have a fever or when they have other symptoms of malaria. We're seeing some disruptions in the arrival of needed malaria commodities, be they bed nets or be they drugs. As you know, WHO and UNICEF and multiple other agencies have put out a call for the maintenance of essential services, in particular seeking care if you have any of the symptoms of malaria. And it's one of the ways we're really trying to turn around this potential doubling of numbers.
To what extent is COVID-19 disrupting the global supply chain of key malaria-related commodities?
So at the moment, most of the major agencies, WHO, UNICEF, the Global Fund, the U.S. President's Malaria Initiative, are working very carefully to check these supply chains. We're doing everything we possibly can to accelerate LLIN campaigns to accelerate the delivery. In particular, we're doing huge amounts of work on guidance to ensure that community health workers and health workers, who are those who will be delivering malaria services, receive personal protective equipment so that they can be protected when they deliver services.
With all the attention that is being put on COVID-19, how do we ensure that malaria does not fall through the cracks, given that it is still a top killer for children under 5 in sub-Saharan Africa?
We have a small window. So especially in sub-Saharan Africa, the malaria season will be starting in 4 to 5 months. So we need to act now. Right now is the time where we need to invest in bednet campaigns. We need to ensure that we are pre-positioning supplies, particularly diagnostic tests, particularly anti-malarials. And in particular, we need to, again, ensure that people are not afraid to seek care for malaria. So when they do feel symptoms, that they do go and get a diagnostic, that they get the right treatment. Our biggest concern is that we might see deaths going up because of severe malaria. Uncomplicated malaria is very preventable. Sleep under your bed nets. It's very treatable. Take your full course of anti-malarials. And this is the way that we will prevent it going to severe malaria. It's the way we'll prevent it going to health facilities. And it's the way we will prevent overburdening the health facilities. What we see with COVID is that it's really when the health system is overwhelmed that we cannot survive. It's where deaths go up. So the more that we do to prevent malaria now, we get the bed nets out now, we pre-position supplies, that's how we'll keep and maintain the gains we've made in malaria.
Again, children in sub-Saharan Africa bear the greatest burden of malaria in the world. Is there a need perhaps to innovate in finding solutions for malaria control on the continent?
We are working on a number of different areas. As you know, the 24th of April 2017 was the launch of the malaria vaccine. which we're hoping those trials will come out with a successful vaccine, which we can administer. We're trying multiple different methodologies to deliver, again, protective malaria commodities, something called seasonal malaria chemoprophylaxis, which is very important in the northern Sahelian region. And we are also beginning to look now at intermittent preventive treatment in infants. So again, looking at very specific area groups to try different methodologies.
What about local solutions? Are organizations such as UNICEF and WHO supporting local communities to find solutions at their level?
I think the most important is support your local community health worker. So we've been doing huge amounts of training to ensure, for instance, integrated community case management. We have proven, and we've shown together between UNICEF and WHO, that community health workers can safely and effectively deliver services and drugs for all three of these areas. We are also discussing and working about other point-of-care diagnostics that could help you to discern between what is a bacteria, what is a virus, and what is malaria. And especially, I think the COVID-19 pandemic has shown how important it is to do proper sanitation, good hand washing to protect yourself from viruses.
Now, the African members of the End Malaria Council have released a 4-part action plan calling on African and global leaders to act quickly, among other things, to protect the decades of gains against malaria and continue investments in building an essential health workforce. And that's all for today. To stay in touch, find me on Twitter at Lenormodou. Esther?
Thanks, Lino. Be sure to join Africa 54 each Tuesday for the most up-to-date health news from Lino Modu. Doctors and medical researchers are studying whether antibodies in plasma from recovered COVID-19 patients are effective in treating the disease until a vaccine against the virus becomes available. A family here in Washington, D.C. that has recovered from coronavirus is now helping to make a difference by donating plasma for research. VOA Saqib Al-Islam has the story.
20 years old Leo Candy tested positive for COVID-19 in late March after returning home from college in New York.
The scariest part was that thought in my mind of hurting someone else, hoping that people I'd been in contact with and my family specifically were all okay.
Leo lives with his parents and 3 siblings in Washington. He quarantined himself in his room, but his mother, a nurse practitioner, also came down with the coronavirus in April.
We were all quarantined to the house for 2 weeks. It was about 4 weeks of all of us in the house all the time. On different quarantines.
Michelle is sure she was not infected by her son. After Leo recovered and tested negative in mid-April, he donated his plasma, which researchers hope to use to both prevent and treat COVID-19 infections.
It seemed selfish not to. If there's any possibility of helping someone, it's just something you kind of gotta do.
Antibodies recovered from COVID-19 survivors are a potential therapy when transferred to patients battling the disease, says Dr. Arturo Casadewal of Johns Hopkins University's School of Public Health.
In every epidemic in the past, since 1900, in 1918, during the SARS epidemic, during the Ebola epidemic, physicians often reach out to use plasma because it is something that is available once you have survivors.
According to Dr. Casadewal, more than 7,200 people have been treated with plasma in the U.S. since March 1st, and the number continues to rise, giving researchers an ever larger pool of recipients to study the therapy's effectiveness. For the Candy family, they're happy they were able to help by providing Leo's plasma.
I feel incredibly fortunate that we, knock on wood, we have both recovered. Nobody else has gotten sick.
Cochran says she wants to find out if anyone else in her family has antibodies so they can donate their plasma for the research. Saqib Al-Islam, VOA News, Washington.
In April, the unemployment rate grew to an unprecedented 14.7%, according to a new report released by the U.S. Bureau of Labor Statistics. It is the highest unemployment rate and largest single-month change since 1948, when the U.S. Bureau of Labor Statistics started keeping records. While White House experts are hopeful the economy will quickly rebound, others are not so hopeful. VOA's Elizabeth Lee has the details.
The new coronavirus is not only a danger to health, it is also devastating to the U.S. economy. The number of jobs lost in the U.S. hit 20.5 million in April. It's not going to get better in the near future, says White House National Economic Council Director Larry Kudlow.
I think the numbers for May are going to be also very difficult numbers. It's going to take a while for the reopening to have an impact.
Kudlow says even with devastating job losses, he sees a glimmer of hope because a number of the unemployed are due to furloughs and temporary layoffs.
That, by the way, doesn't assure that you'll go back to a job, but it suggests strongly that the cord between the worker and the business is still intact.
The U.S. stock market has seen gains even at a time of soaring unemployment rates. Analyst Liz Ann Saunders says among the reasons, one of them is the government stimulus.
And two, I think, is on the assumption that the market is looking through sort of the valley and that maybe April will be the worst month, the inflection point. I think there's some risks associated with that. You've got the potential second wave of the virus.
Even with the continued health risks, there have been protests to end the stay-at-home mandates. Many states are gradually reopening, and Kudlow says the signs point to the U.S. economy ending the year on a positive note.
We're going to see a very strong second half of the year, probably 20% economic growth. Next year, 2021, could be a tremendous snapback in the U.S. economy.
But that may be too optimistic, cautions Neil Kashkari, president of the Federal Reserve Bank of Minneapolis.
This is more likely to be a slow, more gradual recovery. Unfortunately, the virus continues to spread. People continue to get it. Unfortunately, people are tragically dying. And when we look around the world, there's evidence that when countries relax their economic controls, the virus tends to flare back up again. If this goes on for a long period of time, I think it's going to go on in some phases for a year or two. I think Congress is going to need to continue to give assistance to workers who've lost their jobs.
So far, the government has provided close to $3 trillion in financial assistance during the COVID-19 crisis. Democrat lawmakers are pushing for another stimulus package, including aid to state and local governments, plus money for testing and the unemployed. Kudlow says there have been informal discussions, but many Republicans are taking a more cautious approach to another stimulus package.
Many people would like to just pause for a moment and take a look at the economic impact of this massive assistance program.
As businesses reopen, people will have to balance work with the potential risk of getting sick from the coronavirus. Many economists say how quickly the economy rebounds may depend on when a vaccine becomes available. Elizabeth Lee, VOA News.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.